now, I'm going to use Cannula technique. That is a little complex technique, so not many people like using it because it takes some time and a little more learning curve there. Okay. The advantage of the cannula over the needle, it's much more safer, lesser bruising, and lesser infiltration into the blood vessels. Okay. So what that means is lesser complications like skin necrosis, blindness, and strokes, which fillers can always do. Okay. Okay.
Excuse me.
Yeah, she has bronchiectasis, so she gets a cough when she's laying, so she cannot lay all the way flat, so she does the best she can. Okay, so this is the cannula. We got the cannula connected, and I always make sure there's no air, so I'm going to check to see if the filler is nice and out almost in the cannula. Okay, I'm prepping the cannula. Okay. Nice, I can see the filler right there. The cannula is ready to go. Okay, and now I'm going to take a sharp needle, which is a 21 gauge, going to create a small opening so the cannula can penetrate. Cannulas are blunt, so they cannot cut through the skin. So we need to open your mouth a little, Blanca. Thank you. So we need to create an opening with a sharp needle. Okay, that's it. Nice and easy. And now we take the cannula, insert right through this opening, and nice and smooth it goes. Okay. So the good thing about the fillers we use here already has lidocaine, so they start numbing you up as we're injecting. Okay. So the advantage of cannula is it goes nice and smooth. There's no lumps or bumps, just because we can spread it out evenly and smoothly. Okay. Good. Look at me this way. Okay, that looks great. And now we're going to go into your lower lip. I'm going to make another little opening. How are you doing, Blanca?
Okay.
Okay, open your mouth for me. Perfect. And another opening going this way. Sorry. That's it. So this avoids, if you've seen the video with the other lips that keep poking multiple times. So the cannula, you don't see any poking on the lips. So it makes it more comfortable. Okay. So we're almost done. We're almost done. Right there. Okay, now the cannula is right here, and then we're going to start injecting the filler. So this is lidocaine pre-built into it, pre-mixed into it. So she should start feeling the numbness already. Okay, look at me, turn towards me. All right, I'm going to turn her towards this way and get to her other side. You doing okay, Blanca?
Yeah.
Okay, perfect. And could you scoot towards me? Perfect. All right, and open your mouth for me. All right, we're going to get to your lower. You doing okay otherwise?
Mm-hmm.
Okay.
Looking for a place that I could find a doctor that could also work on my face and work in something that I feel somebody that I could trust. And I found Medrein, and I met Mita, and I love the way she works. Every time when I here. The environment is so nice, and she's very professional when she's working with you. Especially, she was telling you every detail, every time that she's gonna do something. For simple, whatever it is, she explains you everything, and she makes you feel confident. That's why I chose to come here, and I really